Are you keen to learn more about how you can prevent yourself from getting an eye infection such as the one on screen now? Do you love both contact lenses and makeup? Have you been a contact lenses wearer for some time and have found that bits of makeup end up getting into and onto your contact lenses and therefore causing you irritation through the period of you wearing contact lenses? Have you ever wondered whether it is advisable for you to share makeup with others? Do you often wonder and question yourself whether you should be replacing your makeup products regularly? If any of these questions or any other questions have come to your mind regarding contact lenses and makeup, then please do continue watching this video to learn more about this very interesting topic. Patients often ask, can I wear contact lenses and makeup? The answer to this is yes. One of the basic sets of rules that you should try and follow is put your contact lenses in before applying your makeup and then take your contact lenses out before removing your makeup. It is advisable to avoid powdery and metallic shadows, and it is also advisable to avoid mascaras with fibers in, because these can get entrapped in and around a contact lens and then result in ocular surface irritation. Several makeup brands now offer solutions to this issue by offering products that are compatible and good to use when patients also wear contact lenses. The large and main component of this video will be filmed in a question and answer format. However, before getting onto that, I would just like to point out a few key points. Initially, I will begin by discussing a few key fundamental basics. I will then go into a few key anatomical factors, and then contact lenses factors, and then makeup specific factors. So let's get straight down to it. In terms of the absolute core basics, remember, whenever you are handling contact lenses, that is either putting them in or taking them out, always thoroughly wash your hands with soap for the correct duration of time, and then once you have done that, thoroughly dry them, ensuring that you do not get pieces of fibers off a very fluffy towel onto your hands and fingers, because then these can get transferred across to the contact lens and cause you irritation if they get stuck behind the contact lens. The next thing I want to mention is know the anatomy of the eyelid. So it is advisable to avoid applying makeup to the edge of the eyelid. This is because if you look on screen now, the edge of the eyelid has several important glands along it. These glands secrete an oily substance that helps to form part of the tear film. If you watch my video about dry eyes, you can learn more about this and the components that make up tears. Essentially, if these glands are blocked and this oily substance is unable to leave these glands and contribute to the formation of the tear film, it will mean that one's eyes will become dry, and secondary to this, they will become terribly uncomfortable. If a contact lens is then added into the equation, the eye will feel potentially even more uncomfortable. Also, blocked glands increase the risk of patients developing infections such as styes. There are different schools of thought about tight lining. Some say that it should be avoided at all costs. Others say that it can be done, but it should be kept to a minimum. It is probably advisable to try and avoid it. However, as some schools of thought say, if it is essential for you to perform tight lining as a makeup routine, then please do keep it to an absolute minimum for the reasons that I have outlined above. However, anything that you do is at your own risk. However, what must be said is, if you do apply makeup to this region, or you generally apply heavy makeup anyway, then it is probably advisable for you to invest in commercial lid wipes that are approved for use on the eyelids. because this will ensure that you thoroughly clean this area in order to give yourself the best chance of reducing the risk of the things that I have discussed. The next thing I want to mention is keep things simple. So when it comes to mascara, avoid clumpy mascara, because these clumpy bits can then get potentially trapped behind a contact lens or contact lenses. And also, as mentioned earlier in this video, avoid mascaras that have fibers contained within them. The best forms of mascara are, in terms of safety and in terms of ensuring that you get the optimal wear with your contact lenses, is lengthening and volume mascaras. The next part of this introductory aspect of this video is the contact lenses themselves. There are several pros and cons with respect to using daily contact lenses and monthly contact lenses. So if a patient wears contact lenses on a daily basis and they are monthlies, and the patient also wears makeup on a daily basis, those 30 days or so of the shelf life of the particular pair of contact lenses that the patient is wearing may be reduced, and towards the end of the 30-day period they may become uncomfortable, particularly if the patient has not been cleaning the lenses as optimally as possible, because day upon day, if debris builds up and it is not removed correctly, this, number one, increases the risk of infection and discomfort, but also means that patients may feel that their contact lens has become uncomfortable to the point of they would like to throw it away and get a fresh new pair. If you are keen to switch to daily contact lenses, then a few things you need to bear in mind are they do tend to be more expensive, and you must initially present to your eye care professional to identify whether they are suitable for you, and obviously a fit procedure will need to be undertaken. The obvious benefit of daily contact lenses is that once you've put them in and worn them for the day, you simply take them out and throw them away, so there's no hassle with respect to cleaning them. Even though some contact lenses are licensed to be used for extended wear, it is a known fact that extended wear lenses are associated with the highest levels of contact lenses related ulcers. So it is advisable that if you wear extended wear lenses, to try and potentially go down to wearing monthly lenses. And if patients wear monthly lenses but they are unable to A, either afford daily lenses, or B, they cannot find a daily contact lens suitable for them, then it is also advisable for them to consider the option of going down to a 2-weekly contact lens, which will negate some of the negative aspects of wearing monthlies which I have discussed. What I must stress is that if you wear anything other than daily contact lenses, then it is crucially important that you adhere to the cleaning regime that was advised to you by your contact lenses practitioner, because this will ensure that you get the best wear out of your contact lenses on a daily basis and then throughout the month. Non-allergenic makeup products are also fantastic. This brings me on to the second component of my video, which is the question and answer section. I essentially came across these questions during my research for this video, so I will now share these questions and answers with you. The first question is, should I be using oily makeup products around my eyes? The answer to this is probably no, because if these oily substances get into your eyes and onto your contact lenses, they can cause greasiness of the surface of the contact lens, and therefore this translates into being blurry vision for yourself. The next question I came across was, is it advisable to use mascara that has been marked as being safe to use with contact lenses? The answer to this is yes. The next question centered around eye care products and the question about creams versus powders. So ideally it's advisable to use creams in terms of eye products, but if you must use powders, then ensure that you keep your eyes closed when applying the powder to begin with. Use the minimum amount of powder as possible, and then once you have applied the powder, ensure that you brush off any excess powder. By doing these 3 simple things, you will hopefully reduce any excess powder that could potentially make its way into your eyes and cause irritation and discomfort. The next question was, what happens if I use out-of-date makeup products? The answer to this is it increases the risk of developing infections. It is advised to replace makeup products every 2 to 3 months. The next question I came across was, why should I seal or close makeup products between applications? The answer to this is it increases the risk of infection because it provides a chamber where bacteria can enter and potentially grow and replicate. The next question was, should I use brushes to apply makeup around my eyes or my finger? The answer to this is brushes, because what brushes will do is they will allow you finer precision and control, thereby reducing the chances of you inadvertently poking yourself in the eye. Not only that, but having a brush caress your skin is surely a lot more comfortable than your finger poking and prodding your skin. Another question I came across was, can contact lenses and their fit on the eye be affected by makeup products? I came across this recent paper which essentially answered this question by saying yes. The final very commonly asked question that I came across during my research was, can I share makeup with family and friends? The answer to this is it is strongly recommended that individuals do not engage in such practice. We all naturally have bugs that live on our skins and help to form part of the healthy environment for our skin. Through using makeup products and sharing them, we potentially transfer these bacteria from one individual to another, and if the individual has an infection to begin with, or the makeup product is infected, then this will also be potentially passed on to the other individual. That brings me to the end of my video. Thank you so much for watching my video. If you have found it useful, please do comment, share and like. If you have found this content to be of any benefit to you, then I would be very grateful if you could subscribe to my channel. There are hundreds and thousands of videos on the internet that talk about makeup products, provide makeup tutorials, etc. But I have not come across a single video that has spoken about the content that I have delivered today. So please do circulate this information so that people can wear makeup products as safely as possible pertaining to their eye health and otherwise. Thank you and take care.